Hi, I'm Sam Shields, and today I'm going to present the NNEP Emergent Airway card. This has been recently put together and is now available for you to use. We're going to go through the contents and describe a few of the available procedures. First of all, you'll notice that the card is mobile. It's designed so that you can take this to any room, specifically the red pod if you're going to be doing an intubation that you're concerned about the airway. Just have the tech get the pod and set it outside the room. You don't necessarily have to open it every time, but it will be available. On the outside of the cart, on the right-hand side, are intubating bougies. There should be 5 of them available. There should be also 2 bougies hanging in the red pod in the central column. That's in case you're doing an intubation and you want a bougie right away, you can just have the tech go rip it off the wall. On this side, we still have some ET tube exchangers that are available to exchange ET tubes. The card will be snap locked. You break the snap off, and it's an accordion door, so you're going to lift, pull, and let it drop. On the top shelf, we have LMAs for various sizes from large adult to pediatric. These have not been used much, and I don't think any pediatric ones have been used. We're anticipating discontinuing the LMAs because I think there's a better device, at least for adults. And that device is on the next shelf. In the next shelf we have eye gels. They're sized by weight, from left to right, small to large. So number 3 is for 30 to 60 kilograms. Number 4 is for 50 to 90 kilograms. And number 5 is for greater than 90, based on ideal body weight. If you don't know which one to use the smaller one. We have 2 available in each size. Feel free to use it, place it. If it doesn't fit, grab the other one. They're priced less than the LMA and less than the King Airway. We anticipate increasing usage of this device. This is the package of the eye gel that we have available in the ER. It contains the eye gel, a packet of lubricant, and a retaining strap. You can see on a sideways view that there's an oxygen port. That's specific to this airway, and it's used to be able to do apneic intubation. The nice thing about the eye gel is, number 1, it's easy to place. All you do is lubricate the tip and sides, place it in the airway using the tip going across the hard palate, and then place the retaining strap. We're going to have a video to show this later. You can then bag through the airway, and if you decide you want to try to do a blind bougie intubation, you can place oxygen on this oxygen port, and you will be performing apneic oxygenation while you're passing your bougie and trying to get it in the trachea. And the next advantage of this device is it has a port for a small NG tube on the sides. It's not big enough to do gastric contents suctioning, but it can decompress the stomach air, which is really important, especially post-resuscitation patients that get a large gastric block. You'll find on the right side of this drawer, you're going to find the tube size that fits, the NG tube size that fits in the eye gel. This is a standard number 10 NG tube. Put a small amount of lubricant on the port of the eye gel. Lube up the first 2 to 3 centimeters of the tip. Place the NG tube into the port. Work it up and down for about 3 or 4 strokes, and then advance it into the stomach. The next drawer, we have various airway devices. We have oral pharyngeal airways, OPAs. We have nasal airways, NPAs, we have tracheostomy tubes, Shileys, and an oxygen nebulizer mask. We have various sizes of oral airways only to be used in unconscious patients. Just a reminder of how to size and place this thing. The sizing of the oral airway is based on taking the airway, placing the tip at the corner of the mouth, and the end should hit the earlobe. That's the proper sizing. You put this, you do a jaw lift, place this upside down in the airway, and then when it hits the back of the soft palate, just flip it and advance it. That's it. Nasal airways are used for bagging, and I use them often in patients, even if it's not a difficult airway, especially somebody that's not bagging well, or even if they are, it just makes bagging more simple. So these can be placed in a patient that's even semi-conscious just to help for pre-oxygenation if necessary. So especially with a patient that has some sonorous respirations, you can place this and don't even have to bag. It helps them with 100% O2 by face mask. The proper sizing of it is from the tip of the nose to the earlobe. So it will be, I have to go this way. It's going to be like this. I'm not going to take it out, but it's real simple to size. Tip of the nose, earlobe, oral airway, corner of the mouth, earlobe. When placing the nasal airway, always make sure the bevel is to the side of the septum. Tracheostomy tubes, I'm not going to go over that right now. We are going to have respiratory do an in-service for us to help us feel comfortable changing out the emergent tracheostomy failure. The last device over here is the oxygen nebulizer mask. And this is the mask we use for the albuterol nebulization treatments in the ER on a regular basis. This is to have immediate availability. It is a nice option for a patient that you anticipate maybe a difficult intubation. What you will do is take the device, put it on, and put 3 or 4 cc's of cardiac lidocaine on the crash cart that will be right next to your room, and nebulize it. Ideally, to get good nebulization of the upper airway and trachea, you need to do it 5 to 10 minutes at least. 15 minutes is perfect. Gives good anesthesia. So for the emergent airway that you have to intubate now, it may not be an option. If you go into the room and look at this patient and say, wow, this could be difficult, but the patient's stable, just put the nebulizer mask on for 10 to 15 minutes. Then you can do an induction dose of medication, not do paralysis, and take a quick look. If you think you have a good airway, then you can do your paralysis. This is an option. It's a nice option for the urgent but not emergent airway. In this drawer we have some surgical crike materials. I'm encouraging people to look at the video on the bougie crike. The bougie crike is a very simple technique and to me very effective. I've done one and it was really, really slick. What we have here is it's made up, we've just put together the materials you'll need. We have a chloraport prep for a quick prep of the neck. We have a scalpel for an incision of the neck and for a puncture of the cricothyroid membrane. And we have a 6.0 ET tube, which is the proper size for ET tube for cricothyrotomy in the adult. On the side of the cart, again, we have the bougie. So grab this and grab the bougie and you're ready to go. There's a video linked to the internet and we will be describing this procedure in another video. Next to that we have a percutaneous needle cricothyrotomy kit. It's a Cook catheter. This one is 7 centimeters. It is a 15 gauge needle with a catheter that's ribbed. It has metal ribbing so it won't crimp. You advance this after obtaining access to the cricothyroid membrane in a caudad position 30 degrees. Once you're in, you advance the needle, tape it, and it has its own self-regulator. We'll be doing another procedure video on this. Next to that, we have a double tree oxygen regulator. We're going to be in-servicing the respiratory staff, nursing, and the emergency physicians on apneic oxygenation and proper airway positioning, anticipating this to be taken care of for the physician by the staff before your intubation. We're trying to get these in all the red pods. This is available in case you do not have one immediately available. You'll have one on the airway card. In this drawer we have familiar equipment. This is just backup equipment for the glide scope, including blades, pediatric sizes all the way through the adult. We have glide scope stylets, and we have some of the permanent glide scope blade handles that are sent down to processing for sterilization. These are meant for backup. These should be available on your glide scope card, but if for any reason they're not, you'll have spares here. On this drawer we have larger direct laryngoscope blades, some spare stylets, and we have the oxygen regulator that was so difficult for Allen Rose to obtain, so we can't get rid of it. I'm thinking that we'll put this on the pediatric side because we'll be describing a procedure for airway obstruction in pediatrics, and it may be that we'll use this. For now it's on the main airway cart, but anticipate that moving. And finally, on the bottom shelf, we have one percutaneous milk core Sellinger technique cricothyrotomy kit. These are harder to put in, have a lower success rate, and probably will be getting rid of them. I want to get more of a consensus from the group, because if anybody likes them, uses them, and wants them in there, we can certainly use them, but if not, we're anticipating not stocking these. So get back to me if you think you want to have this. And finally, we have a percutaneous tracheostomy kit for the surgeons. This kit is in case you get an airway stabilized and you need a tracheostomy done. This will be available for the surgeon. We also have them on the trauma cards, however, this is a backup just in case. That's not anything that we'll be opening up. So that's a brief review of the airway cart. This cart is in process. It's going to be modified as newer products come out or techniques come out. For instance, we're looking into getting an Aintree catheter and a pediatric bronchoscope. It's a really neat device that we can use as another emergent airway adjunct. It's a little pricey, so I don't know when we'll get it, but we're working on it. So we'll be doing further updates or email notifications of any changes on this cart. This cart will be available immediately for your use. So if you have an airway where you're concerned that you may have a problem, and even if you just want it to be comfortable that everything's ready, just have the tech wheel it to the room you're in. We anticipate putting together a second airway cart that'll be in Trauma South that will be more immediately available for the red pod. And that's it for the emergent airway cart. Thank you.